So prior to this head-to-toe assessment, I would have gathered my supplies for it, being my stethoscope, pen light, and an alcohol swab, and then also verify the orders in the chart if there was any from the doctor. I would perform hand hygiene as I'm coming into the room and announcing myself. Then I would begin to identify the patient with two different identifiers. So, good afternoon, Ms. Madigan. Can you tell me your full name and date of birth?
Kelly Ann Madigan, June 30th, 1997.
Okay, can I check out your wristband here? Okay, and that matches everything with what's in the system in the chart. So after that, I'm myself going to move on to the neurological part of the exam. I'm just because I'm already talking to the patient. Can you tell me where you're at today?
I'm at the doctor's office.
Okay, and what are you here for?
An annual exam.
Okay, do you know what day of the week it is?
It's Sunday.
Okay, so the patient has already given me more than 4 identifiers that they are alert and oriented, so she's going to be alert and oriented times 4. I've also already provided privacy for the patient in this room, since at this point she would be getting into a hospital gown and out of her regular clothes. So moving on, I've also already assessed that her hygiene and speech, grooming, and her mood is all appropriate for her age, and that she is a well put together individual. Moving on from neurological, I'm going to begin asking questions about her skin and hair. So, Miss Madigan, is it all right if I call you Kelly?
Yes.
Okay. Kelly, have you noticed any sort of thinning in your hair or change in color?
No.
No? Okay. What about any loss of hair, any patchiness, anything like that?
No.
No. And then do you have any scars or tattoos on your skin?
No.
Any wounds, bumps, or lumps that you were concerned about?
No.
Okay. So from there, I'm going to move on to actually inspecting and palpating the patient's skin. So just to start, I'm going to palpate the patient's forehead with the dorsal side of my hand. Feels warm and dry like it should. And then right now, Miss Madigan or Kelly, I'm going to be inspecting your scalp. I'm just feeling for any sort of lesions, any growths, and I'm also inspecting the shape of your skull here, which is normal cephalic. And then your hair is normal color, normal dispersion, and it doesn't feel too coarse or dry. Now, moving further down the head and face here, I'm going to palpate your temporomandibular joint. Is this tender at all?
No.
No. Can you open and close your mouth? And there is no tenderness and there's no clicking. So that means cranial nerve number 5 is intact. Moving on from there, going into some of the symmetry of the face. Can you smile for me? Very nice. Can you raise your eyebrows? You don't have to do this all at once. Puff out your cheeks. Okay, very good. So cranial nerve number 7 is intact, since all of these facial expressions are symmetrical. Moving a little bit lower down to the neck. Kelly, do you have any pain in your neck or any sort of pinching whenever you turn any direction?
No.
No. Is there anything tender?
Nope.
Do you feel any swelling in the sides of your neck? Okay. All right, so from there, I'm going to palpate for her lymph nodes, starting with the preauricular, posterior auricular, your occipital, tonsillar, superficial cervical, deep cervical chain, posterior cervical chain, the supraclavicular lymph nodes here just above the collarbone, or the clavicle. And then there's also the submandibular and the submental. Now, Kelly, was any of that tender or painful for you?
Nope.
Okay. And I did not note any swelling. So Everything is normal here. At this point too, I would have the patient reclined at a 45-degree angle so I can inspect for jugular vein distension, which notionally there is none. After that, I would also palpate and, well, inspect and palpate the carotid arteries here. So on the left, we have a nice regular 2+ pulse. And on the right, we also have a nice regular 2+ pulse. And from there, I'm going to auscultate using the bell end of my stethoscope for any sort of bruits or murmurs. There is 3 positions for the carotid artery in which I do that, just under the jaw, middle of the neck, and then closer to the clavicle there where the carotid is in line. Moving to another cranial nerve test. Can you give me a kind of a neck and shoulder shrug? Okay, another one please. Okay. None of that's painful for you, you don't feel like you're straining? Okay, all right. I'm going to place my hand on the side of your head, and you push into my hand, please. Okay. How about the other side? Okay. So the patient's cranial nerve number 11 is intact. There is no struggle with resistance of pressing into my hand, and she's able to do the neck and shoulder shrug. All right, moving on to the eyes. Kelly, do you have, do you wear glasses normally?
Yes.
Okay. With and without your glasses, have you noticed any sort of vision loss or blurriness more than regular?
No.
Okay. What about any sort of spots or sparkling in your eyes?
No.
No, nothing. Okay. So now I'm going to inspect the outside structures of the eye. So her eyebrows are not thinning, they're not sparse, they're appropriate color. Same thing with the eyelashes here. I'm also going to pull your eyelid down just a little bit, inspecting conjunctiva and sclera, which is nice normal color, good and pink. There's no sign of any sort of swelling or pus or any infection. No growths either. Now I'm going to check pupils here. So bright light. Bright light again. Okay. So the pupils are equal and reactive, round and reactive to light and accommodation. All right, now please just lock your eyes here on the tip of the pen light. Keep staring at that. Okay. All right. Now pick a spot over my shoulder. Now look at my nose. Over my shoulder again. And back to my nose. Again, pupils are accommodating. This is good. Now please follow, again, the tip of the pen light here just with your eyes, not your head. Okay, good. So that cardinal gaze, or the 6th direction of the cardinal gaze, that checks for cranial nerve number 3, 4, and 6. And those are all intact since there was no shakiness in her vision or any sort of other abnormalities. From here too, I would also have the patient use a Snellen chart to assess cranial nerve number 2. But since I don't have one of those, I'll just explain that I would have Kelly here, I would have her read the chart both with the glasses on and glasses off, reading it with both eyes open and then covering each eye. Moving from eyes to ears. Kelly, Kelly, do you notice any hearing loss or ringing in your ears? No. Have you had any ear infections?
No.
Okay. So from there, I'm going to again inspect symmetry. I'm going to visually look at it, and then I'm also going to palpate for it. Just none of this is painful. No. Okay, I notice no growths or abnormalities here. Can you turn your head that way for me? Right now, I'm inspecting for any abnormal amount of drainage. All right, turn your head the other way, please. Or earwax, which there is none, more than usual, so it's also good. I'm going to palpate here down at the mastoid process. Is this tender at all?
No.
No pain?
No.
Okay. All right, now I'm going to perform something called the whisper test. If you don't mind turning around for me, so normally I would move for the patient, but for the sake of the camera setup here, I'm going to do it this way. All right, can you cover an ear for me, Kelly? All right, and then just repeat the 3 words that I say. Blue car dog.
Blue car dog.
Okay, and then cover the other ear. Red Jeep cat.
Red Jeep cat.
Okay, you can turn around for me. So Kelly successfully completed the whisper test, which one means she has good hearing, and also cranial nerve number 8 is intact. Moving on to the mouth, I noticed that her lips are symmetrical and are an appropriate color. So Kelly, have you had any pain or toothaches, or do you feel like there's anything missing in taste in your mouth?
No.
No. Do you feel like anything in your mouth is abnormally dry?
No.
Okay. So now from there, as I said, I've already noted that her lips are symmetrical. Can you open your mouth for me? Okay. So, all right. And can you say ah?
Ah.
All right, and stick out your tongue. Okay. So, oral mucosa is pink and moist as it should be. Her gums do not show any sort of redness or inflammation. Tongue is normal. There's only one split down the middle. Her teeth are nice straight. There's no cavities or any sort of other abnormalities with them. And one of the last things I'm going to have you do, can you say light, tight, and dynamite?
Light, tight, dynamite.
Okay, so that is assessing for cranial nerve number 12, which is also intact. All right, moving on to the nose. Kelly, do you notice any sort of lack in smell or change in it?
No.
No? Okay. Have you ever had your nose broken before?
No.
All right. Any sort of pain?
No.
Do you also get nosebleeds frequently?
No.
Okay. Excellent. So from here, I'm going to, again, just inspect for symmetry, which is symmetrical. Just going to palpate here, feeling again for any sort of growths. And while I'm here, I'm going to palpate maxillary sinuses, which they do not feel swollen. Is this tender or painful?
No.
Okay. And then the frontal sinus, again, same thing. I don't believe it feels inflamed at all. Is that tender or painful?
No.
Okay. And then also I'm going to check inside your nose, so you can tilt your head back for me just a little bit. Pink and dry, which is good. And you level your head. I noticed that there's no deviation, that there's no abnormal drainage coming from her nose. So, Kelly, can you close your eyes for me and then plug one nostril? All right. What does that smell like?
Alcohol.
All right. Plug the other nostril for me. What does that smell like?
Alcohol.
Okay, excellent. So that smell test assesses for cranial nerve number 1, which is intact. So moving from nose, I'll be going on to the anterior and posterior chest. Kelly, have you ever noticed that you were having any sort of chest pain?
No.
Shortness of breath?
No.
Okay. Are you a smoker, or were you ever a smoker?
No.
And have you ever had any sort of exposure to environmental hazards, say living next to a factory or a big refinery or anything like that?
No.
Okay. All right, so again, I'm just going to inspect for symmetry, which appears to be so, and then I would palpate using the dorsal side of my hand again, palpating for temperature. Moving on from there, I would also be palpating for any sort of growths or abnormalities within the ribs, making sure that they're appropriate shape and size. And then from there, I would also percuss over the entire fields of the lungs here. And then after percussing, I would also auscultate over the entire lung field here as well, having the patient take a deep breath in and deep breath out, and me listening to the full inspiration and expiration. So, give me a deep breath in and out. Just give me nice deep breaths. Okay. So I noticed clear breath sounds. The patient's expression is normal, no pain. Also noted the patient's expression while I was palpating around. There's no pain or wincing or guarding. From there, I'm also going to auscultate each of the heart areas that you can just breathe normal for me. Let's start over here, the aortic, pulmonic, Erb's point, tricuspid valve, and the mitral valve. Also to note, with female patients, sometimes you may have to ask them for assistance to move the breast out of the way. And then also you cannot auscultate lung or heart sounds through a breast because of the density of the tissue. So moving on from the anterior chest, I will have you turn around, please. And also, while auscultating, I noticed there was no murmurs or bruits over heart, and there again, just regular sounding lub dubs. All right, so to the back of the chest here, I'm just gonna move your hair out of the way. Thank you, Kelly. I'm again gonna be palpating for temperature. I'm just checking the size of the chest here. And I'm also going to check for tactile fremitus really quick. Can you say 99?
99.
And again?
99.
So notice there is that good vibration there in between the shoulder blades. From there, going to check for nice symmetrical chest expansion. So putting my hands in a nice kind of a W here. I'm going to put them in about the T10 vertebrae, kind of pinching my thumbs together. Deep breath in, deep breath out. Nice even chest expansion. All right, and you can turn around for me. Or actually, sorry, never mind. Need to continue with the rest of this. So I would again, after done palpating, I would percuss over the entire lung fields here. And then I would auscultate all 18 spots over the lung fields here. There's 9 on each side, but for the sake of not having Kelly pass out here, I'm just going to go through a few of them on each side. All right, deep breath in and out. Just nice deep breath for me. All right, and then skipping a few here so she doesn't pass herself out or get too lightheaded. Okay, all set. And again, nice clear breath sounds. Kelly, you can turn around for me now. And again, I would be moving around the patient. The patient would be moving for me. All right, moving on to the abdominal part of the assessment. Kelly, do you notice any sort of change in your diet or your appetite?
No.
Any pain before or after eating?
No.
Or during?
No.
Okay. Have you noticed any sort of change in urination or your bowel movements?
No.
Okay. Also, do you take any sort of medications as birth control?
No.
Do you use any sort of measures of birth control?
IUD.
Okay. And has your menstrual period been regular, relatively speaking, to that birth control?
Yes.
Okay, good. All right, so from there, after I've asked the subjective questions, I'm now going to listen to your abdomen. I'm going to start in the right lower quadrant, move up to the right upper, and then left lower. But Kelly, I'm first going to have you lay down over here. And then while also auscultating all these, and you auscultate first, that way you don't interrupt any of those bowel sounds, making it sound hyperactive. But while I'm here, I'm also going to be auscultating for the aorta, the renal artery, iliac, and femoral. All right, just breathe normally for me. Now moving on to the arteries, the aorta, renal, iliac, and femoral. And then from there, after auscultation, which I noticed they were just normal, active bowel sounds. So that's the gurgling, no tinkling or rushing, and it's also not silent. If it was silent, I would listen for 5 minutes before actually declaring it as a silent bowel. Moving on from there again, move to percussion, again around right lower, right upper, left lower. From there, I would move into palpation. So just to reiterate, you're not in any sort of pain?
No.
You don't have any tender areas in your abdomen?
No.
Okay. If there were any tender areas, I would palpate those last. But starting with the soft or superficial level of palpation, just going to be pressing in with my hands in a nice circular motion. And this is just going to be feeling for any sort of tenderness in the area, making sure that the patient, I'm mainly watching the patient's expression here. If they aren't wincing in pain or they're not guarding, it is normal though for a patient to guard just a little bit because they may be ticklish or this is uncomfortable for them to do. So moving on from that down to deep palpation, this is where you're going to feel any sort of enlargement or growths of organs. So this is going to be pressing a bit deeper. Again, let me know if any of this hurts. All right, I can have you get up now, Kelly. And then just come sit back over here for me. Okay, so again, no enlargement of organs, no growths, and also she wasn't guarding or tender or showing any sort of pain or wincing in her face. Moving on to your extremities, Kelly, so your arms or legs, do you have any sort of pain in them whenever you're moving them, or any sort of cracking, popping, anything like that in your joints?
No.
What about numbness or tingling in any of your toes or fingers?
No.
Okay. So, would you also say if you have any limitation in what you can do as far as activities go?
No.
And then also, have you ever broken any of your bones?
No.
Okay. So from there, I'm going to palpate again for temperature. I'm going to be inspecting for color, hair, any sort of lesions. And this, if she mentioned any scars or tattoos, I'd also take a look at those. So looking around here, it looks to be normal. Palpating for temperature here. Again, warm and dry, as it should be. While I'm here on this arm, I'm going to palpate for radial pulse, 2+ and regular, brachial pulse, 2+ and regular, again, warm and dry, radial pulse is 2+ and regular, and so is this brachial pulse here, it's 2+ and regular. So, along here, does any of this feel tender or sore to you?
No.
Right now I'm just palpating the joint for sort of inflammation, pain. She did get her second shot of the COVID vaccine today, so I am trying to be a little bit gentle to the shoulder. How about your wrist here? Everything okay?
Mm-hmm.
You know if there's any pain or tenderness. I would also do capillary refill, but she has her nails painted. Ideally, we want this to be refilling. You give the fingernail a squeeze, and that would refill in less than 3 seconds. So can you bring your arms up for me? Just curl up, and then just raise your shoulders, and then flick your wrists. Grab. Okay. All right, can you grab onto my fingers? Grab nice and tight. Okay. Let go, and then grab out of my hands. All right, and then pull. Pull. Okay, great. So her joints, I don't note any soreness or tenderness or inflammation. She has a nice firm grip. She has appropriate upper body strength. And also I don't note any edema in her upper extremities. Moving on to her lower extremities, can already see that there's no edema or cyanosis here or any sort of abnormal coloring in her feet or lower extremities. Again, just going to be palpating for temperature here. And the skin is also warm and dry. And the same thing on this leg. I would also do capillary refill here, but again, she has painted toenails. We want that to be less than 3 seconds after you give it a squeeze. Here I'm going to palpate the popliteal pulse behind the knee. I would have her straighten out her leg, but we don't exactly have a lot of room here. So 2+ and regular. Posterior tibular pulse back here. Two plus and regular. And then up on top of the foot is the dorsal pedis. Just 2+ and regular. And again, the same thing on the other side. It's 2+ and regular for the popliteal. Posterior tibular. 2+ and regular. Dorsal pedis. It's 2+ and regular. All right. And then also, can you lift up your foot for a second? Looking for the plantar reflex, which there is. Tickle a little bit.
Mm-hmm.
Okay. So I'm also going to palpate the knee here. Note any inflammation. They're not sore, tender, painful.
No.
And then the same thing for this knee. Sore, tender, or painful?
No.
Okay. How about your ankles here?
No.
All right, can you wiggle your toes for me? And then lift your left leg. lift your right leg. And then, all right, point your toes towards your nose. Okay. All right, so appropriate strength in each of the areas of lifting your leg and kind of pointing your toes. There's nothing abnormal there. So now I'm going to have you stand for me. I'm going to have you close your eyes, feet together. And the Romberg test here. Notice if she's swaying or losing any sort of balance here. All right, you're good. So, and then also, can you take a couple steps that way for me? Just gonna watch your gait. And then back to me, please. Just a nice, steady, and straight gait. All right. You can sit down. Thank you. Can you put your finger to your nose? Okay. Very good. And then just slide your heel over your shin. And then do that for the other side. And then this is all assessing the musculoskeletal / neurological part of the assessment here. Now that we've finished up with that, moving on to a patient education, I'll be talking to you about self-breast exams. So have you ever been taught about this before?
Yes.
Okay. Normally here I would have the patient just teach me back what they know. But in this instance, for the sake of being able to educate, I'll go ahead and say this. So you'll want to pick a time, normally 3 to 4 days after your menstrual period is over. That way you avoid palpating for any sort of tenderness that does come with the menstrual period. You're going to start in a upper corner here, closer to your armpit or axilla, and you're just going to start palpating. So you can palpate soft and then palpate nice and deep, with nice circular motions, and you're just going to kind of make a swirl here over your breast, making sure to cover the entirety of the area, getting under the breast area here, and then also around your nipple, and then also kind of close and almost into the axilla there as well. Up here is a very common area where growths are located. And you do that for both breasts, again, 3 to 4 days after your menstrual period. And make sure you do that at roughly the same time each month, which if you still have your menstrual period, it will be. So that concludes my head to toe assessment and my patient education. Do you have any questions for me?
No, I don't.
Okay. And at this point in time, I would help the patient if she needs getting back into her regular clothes, setting anything up in the room for her, such as call light, get her a cup of water, or anything like that. And I'm going to document my findings as well. And that is all.